for watching my YouTube channel today. Today I feel privileged to have two lovely dentists with me, Yusuf and Nikhil. Yusuf finished his training last year and Nikhil is currently my trainee. Both worked very hard on their case presentations and got first prize in their case presentations, and today they want to share a few important hints and tips with you. So guys, I'm going to hand over to you two, so if you can actually tell your colleagues, your fellow dental foundation trainees who are actually starting the foundation training on some tips and hints, so they know before they start the case what things to look out for.
Right, so I think if you're looking for a case, you've got to have something that's got lots of disciplines in it. So I don't know what you do for yours, but making sure they have maybe like keeping it simple, like perio, restorative.
I also think it's important to keep it simple and plan it out ahead. If I was giving advice to a new VT, I'd say get the educational supervisor to come on over and have a look and plan it out effectively. You obviously want to take good special investigations such as X-rays and radiographs. And photos, clinical photography, and that's a very good tip to give. Taking good photos can make the difference between a good presentation and a poor presentation.
Try and make sure that you have more than one case, just in case maybe for some reason the availability of your patient, he's not able to come into the session, so having more than one case and making sure that you take photos of them and document everything that you do is really important. When planning the case, make sure that you talk to your educational supervisors and use as much resources that you can, so you build up a case that is good and it's built up in the right way.
I think there are a lot of materials to use, so giving the patient all the options and thinking about how you can incorporate this into a treatment plan that's best suited for the patient, but also shows that your ability to deliver good quality dental care expected of a GDV in practice. So I think that summarised quite a lot that we've discussed.
And making sure when you know your materials as well, so if you're going to use a specific type of crown, making sure that you have the available materials to cement it in without the practice, know the correct protocols for how to use it and things like that, because those are some of the questions that they will ask you when you do present your case.
I think very good valid points, guys. Thank you very much. One of the other important things is that you need to know what the scoring sheet is and what things the examiners are looking at, so that from day one you get it all correct. For instance, diet sheets are important, good photography, which I think you guys mentioned, are important, diagnostic investigations, vitality testing, all those count towards your points. Obviously getting good study models from the start. And I think treatment options and also phasing your treatment plan are very important. One of the other things which I think one of you did mention is that it's important to have a few cases lined up, because don't rely on one case, because that one patient may not be able to show their commitment for your duration of time while you're completing the case. So it's better to have several cases lined up, so that if one person for some reason couldn't see through their treatment plan, then another patient could come across and you'll still be sort of on par. But I think one valuable thing that these guys have learned is that it's very important to get good photographs initially from the patients, and also good radiographs. So those are the key things, isn't it? Is there any other things? I mean, you mentioned materials, which is very good. You need to make sure that what the work you're doing is within the merit of your practice, and your practice has got those materials available. Talking to the technician is very important, and also maybe taking Facebook records are very important as well. Is there anything else you guys think that you should add?
Just keep it simple, keep within your limits, and just get as much help as you can from the supervisors.
I'd also say presenting the case the day before is very important, so that you can get your presentation appraised by a person who understands what's expected of a DFT.
Yeah, I think one thing which made these two stand out from the rest of the group was that they actually presented their case many times to many different people, and role played it a lot, and we bounced off a lot of questions off them so that when they were presenting they had the whole thing covered. And one of the other things was that they actually chose the case quite earlier on in their dental foundation training, so they had plenty of time to think about it and plenty of time for things to go wrong and be able to put it back right again. So thank you for watching, and follow me on Dental Cosmetics on Instagram, and also subscribe.